I think we'll go ahead and get started. Um, for most of you that have heard Mr. Murphy speak this morning, we're going to introduce him one more time, but his reputation precedes him. Mr. Murphy's from West Hartford, Connecticut. He is the Strategic Partner Relationship and Enterprise Project Manager for Cigna. He also is the founder and head of Social Media Listening Center and a national speaker with an innovative and disruptive approach to produce consumer insights and analytics for the emerging healthcare field. He leads, manages, and mentors a growing team of talented social media analysts. So thank you for being here today, and thank you for coming.
All right, I don't think I'm going to use a microphone. You guys can all hear me okay? Cool. So what I want to talk about in this hour is pharmacy side effects. So they asked me to talk about this. This is an area where this is real, not as much future-oriented. It's actually happening now. And that's using, if you heard me earlier today, it's using the data that people are sharing on social media to actually start documenting side effects of medications. So right now, pharmaceutical companies, clinicians, they're documenting side effects based upon when the patient comes in. This is different. This is going to be collecting off of social media, which I think is pretty cool because we'll talk about it. So you heard me talk about it earlier. We don't need to repeat that. How much people are on social media. But let's talk about the clinical piece of this. People are on, all across the world, social media, researching advice for whatever their ailments are. So, for example, I have a daughter with autism. When she was little, the internet was just starting. I was out there trying to figure out, what do we do? I think it's probably the same for everybody in this room. If you had a sprained ankle or an ACL injury from sports or a serious illness, we kind of all go out on the internet and we start researching. What's going on? What should I expect to, is my journey a little bit? Find out, inform ourselves. And as Kim was saying earlier, when we show up these days at a clinician's office, most of us show up pretty informed. More so than ever before, for sure. We'll show up with maybe a whole bunch of documentation of what we found or some ideas. So it's a whole different game now. So this is what I was talking about earlier, physicians and clinicians being on social media. If you're showing up, if we're all showing up, having learned more about our ailments from being on a forum or a discussion group on social media, we expect our physicians to be participating in that conversation. Now, we don't expect them to break HIPAA rules, we don't expect any of that, but we expect that they know and that they're out there. So here you go, American Heart Association. In a survey of patients at an outpatient family clinic, 56%, this is a survey, this is not social media data, it's a survey, wanted their providers to use social media for appointment setting and reminders, diagnostic test result reporting, health information sharing, prescription notifications, and answering general questions. Now clearly, the average citizen may not know about HIPAA rules, but point being made, all of us are now expecting a lot easier interaction with our physicians because we're coming empowered, we're coming more knowledgeable. We expect them to play the game with us, join us in that conversation, join us in that journey to make it a little bit easier for us. So, as Kevin MD and others are doing, they're promoting, and some of the folks here talking today, They are now exploring ways to use social media, share information, and more physicians will be in the future. Good example is I had a gentleman work with me in IT for several years. He was in his 20s, really into technology and social media. He decided to go back to school and become a physician. He just graduated after 4 years of med school last April. He's now an MD in Connecticut. And he continues to tell me how his classmates and they're all on social media. They're all on the forums and discussion groups. That's what they all do. So I think a lot of it's people my age who are physicians and have been physicians for 20, 30 years, they're transitioning. But in the future, I would, more and more every year, that wave's going to come through, and they're all going to be on social media and using all forms of technology. This is an interesting thing that I found, crowdsourcing. Does anybody know what crowdsourcing is here? So crowdsourcing is when groups get together to find an answer. So in this case, what we're starting to see is physicians crowdsourcing for answers. This is an example of physicians using social media. So Sermo is a physician-only social networking community. So you need a credential, you need a login, an ID. It's not information I'll gather on social listening. But physicians across the country will be on a social media community, and they are sharing stories with each other. So just like we are all sharing stories amongst ourselves just in the public, this is an example of how physicians leverage social media to get information from each other quicker. So maybe up until now, or recent, they might have to go to a conference or do some research on their own at the local university or talk to some experts. Now, if you're a physician, there are communities for you to go out and say, hey, I've got this patient, they are presenting with the following issues, here's what I'm thinking, here's what we've been doing, and they may not even know anybody on this community personally. Boom, within a day, they've got dozens of potential answers, feedback of what physicians around the country or in the world are seeing in that patient, that type of patient. This speeds up solutions. Just like if you want to go to a restaurant and you want to, okay, I'm thinking of going to Joe's restaurant. You'll go out to Yelp and find out what people think of Joe's. And then after you go to Joe's, you'll put in your own feedback, right? So now you got this virtual community all sharing information about Joe's restaurant. Doctors are starting to do the same, and we want to encourage more of this with each other about ailments. They need to be sharing information with each other like that. It's pretty cool. The last bullet here is HIPAA related. So obviously HIPAA is huge, especially in social media. A lot of boundaries you cannot break. There's a community called Doximity. It's probably a play on words, docs, in proximity with each other. And what they're doing is sharing information with physicians as to here's what you can say, here's what you can't say if you're on a public site. This is all part of the game of educating physicians to use social media to gather information, get information, help your patients, and do it so in a compliant way. So let's look at some clinical data. I'll talk about clinical. This is peer-to-peer healthcare, which is what I was talking about before, especially with chronic illnesses. So look at the numbers. 23% of all U.S. adults who have a chronic illness such as hypertension, diabetes, etc., cancer, had gone online to find others with the same condition. So I know, as I was saying earlier, I did this with my daughter. Kim, I don't know, did you do things like that when you were researching? Yep. So as Kim was saying earlier, empowering ourselves as we have our relationships with our physicians and clinicians, more and more, that number is 23% in 2011, it's probably up into the 40s now. This is what everybody's doing. Qualitative analysis. So I think a lot of this feeds into what Kim was saying earlier, the support networking, the information gathering, family sharing. So, qualitative analysis, we're trying to figure out how to support ourselves as we go through this journey of a disease. So, once again, there are special groups on Facebook, there's forums, there's blogs. People join, share, and help each other. So this is new in the last 5 years or so. There's also subcultures on Twitter. You guys probably aren't aware of this unless you're out there. Where physicians are beginning to monitor these subcultures. So on Facebook, on Twitter, blogs, discussion groups, there might be a subculture called diabetes, subculture called, certain specific types of cancer. And in these subcultures on social media, people are going out there and sharing all these stories that we're talking about. And the physicians are starting to monitor them. Because maybe, I think probably, a lot of patients go to the physician and they don't feel, I don't know whether it's the physician or, as Kim was saying earlier, the type of relationship, they may be closed-mouthed more than you think. But people will go out on social media and they'll say anything. They'll ask the real question. So maybe when they're with their physician, the physician's asking the question, and the patient's going, yep, no, yep, no. Then they'll go home, go into one of the subcultures, and write a whole paragraph expressing their feelings about what's really going on with them. It may be emotional. Maybe, I feel depressed. I feel disconnected. I feel alone. And these subcultures, physicians need to start monitoring if they're not already, because they can learn a lot about what people share in these subcultures on social media versus what they share face to face.
Can I ask a question?
Go ahead, Kim. Sure.
So, in my experience, what I have found is people who go online and comment, it's usually the negative comments. Is that what you see more often? It's negative versus the positive? Because it's almost as if people have a good experience and they move on from it and they don't always post about it. But if they have a negative experience, they don't stop posting about it. You know what I'm saying?
Yeah, I'm seeing a small shift lately as social media becomes more popular. I think the first few years of social media, definitely true. We're starting to see a shift now where people are sharing positive stories. We're also seeing, like, if you complain about a physician or complain about a brand, 4 years ago, 3 years ago, that might go viral. Now it's really interesting. We're starting to see people behave on social media like they behave in real life. So, if they're on social media and let's say you complain about a company, but then someone jumps in and goes way overboard. We're starting to see people jump into the conversation and say, whoa, 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 whoa. I think you're a little bit out of line here, Mr. Jones. I don't like that company either, or I had a similar experience, but I think you've gone too far. They're not that bad. We're starting to see people jump in and correct each other, which is really interesting for me to observe. So I'm starting to see people behave on social more and more like they behave in real life, especially as I think all of us get used to what social media really is. So we're not letting the negative loud voices own the conversation. People are finally going, somebody needs to step in here and be the adult in the room and share a positive story here. So we're starting to see more of that. And I also think, especially with diseases and illnesses, we're starting to see people share positive results because they want to get the word out. That, hey, I did this and this, and it resulted in that, which worked for me. I hope you all can maybe take a piece of that, go to your physician, share that story. Bottom line is, this entire conversation is really all about, so what do we got in here, about 25 people. If I had an idea by myself and I documented it, sent it to my boss or one person, it's one person's idea. But if we were all here crowdsourcing an idea, by the time we left this room in 10 minutes, we'd have a far more powerful, effective message than one I came up with just by myself. And I think the same goes for physicians. If they crowdsource solutions, patients crowdsource findings, we get to the answer quicker. So the next piece I want to talk about is the quantitative. This is actually pretty cool. This is when people are sharing the specific information about their medical condition, and social listening is able to aggregate it. So a gentleman asked me earlier, what's your name, Jeffrey? Jeffrey. Typically, this is not Facebook or Twitter. Typically, this is forums, health communities, where let's say there's an autistic parental assistant community. So you join it. It's public or private. If it's public, we can access it and see the quantitative data. So we're seeing everybody talk to each other and share stories about maybe how to support the caregiver of an autistic child. And we start quantifying what the conversations are about. And we start really measuring the needs. Because once again, maybe those parents are too busy to go report their concerns to their daughter or son's physician or to some official board, but they're all out there talking with other parents about the challenges they're facing with raising an autistic child. If you're a smart social listener, which we're going to get better at as each year comes around, that data can be quantified, shared with physicians or caregivers and say, look, did you know that X% of parents have the following top 3 concerns as being a parent of an autistic child? And the physicians, in some cases, that information, just like it is in any other business, they might go, I had no idea. I have parents all the time, and they never talk about that. That's what measuring these quantitative conversations can do for us. Oops. Another angle is, I want to go back. Self-reported patient data. So I had an old high school and college buddy who was a fighter pilot in the first Persian Gulf War. And about 5 years after the war, he came down with ALS. And this is before social media, but Web 1.0. Web 1.0 was the first version of the internet where we shared information, but it wasn't interactive. He was a really cool guy. He passed away a few years ago. He was constantly on the internet trying to figure out what this disease meant. And he was documenting everything. Now, if he had that disease now, well, he would have been one of the perfect candidates to be documenting on social media every day his experience. This is real data. Now, a smart social listening team knows how to filter out the noise, filter out just the general complaints, and pull in all the conversations about that person's real experience with ALS. This is self-reported patient data that potentially, like I was saying earlier, the patients aren't sharing in detail or full with their physicians. And also, maybe they don't have a lot of time with their physician. You know, physicians are busy, they walk in, you've got 15 minutes, go. And then you go home and you go, oh yeah, I forgot to tell him or her this. Well, maybe next time. Well, guess what? 3 weeks in between appointments, people like my old buddy here, he would have been on social media documenting everything from morning to night. This is self-reported patient data that can be collected and added into larger databases to give a clearer picture of maybe some solutions. Go ahead, Beverly.
I would think that this would be great to use for mental health.
Yeah.
I mean, it's kind of like a group,
Yeah.
therapy session with each other that the physicians could monitor or something.
Yeah, no, I know. Wait, I often frame all of social media as a giant experiment in human behavior. So let me go back to that and come back to this. I have so many people, they look at me and go, you do what for a living now? And at first, at my company, they'd walk by me and go, so you're just basically playing on Twitter and Facebook all day, right? Like, no, not really. And then people would come by and say, did you see what so-and-so said on Facebook? Are they nuts? And we all probably have that experience in one way or another. But what I like to frame that as is it's an incredible window on human behavior. We get to see how people are thinking and feeling that they never would have shared with you in person. But they're more than comfortable sharing with you or anybody else on social media. So to your point on mental illness, I think one of the things, there's a plus and minus on social media sometimes. Social media keeps us disconnected from the human conversation. And when I work with my students at the University of Connecticut, I'm constantly working with them on what would you do if you couldn't go on social media for a day? We had this experiment the other day, and one of the students raised their hand and said, well, I went camping this summer and I couldn't get online for 3 days. The first 2 days I was very anxious. I was very anxiety driven. I felt disconnected from my friends. And I didn't know what was going on. Then the third day, I felt great. I felt free. And I started connecting more with the people I was camping with. Because I think we're all doing this. How much do we see this now when we walk around the city? Right? People it's like, oh my God, it's easy to kill yourself. Why don't you look where you're walking? But we all are guilty of it in one extreme or another. But on the flip side, mental illness, I really wish there was a way people could connect and share person-to-person mental illness situations. Fortunately, maybe due to the mental illness or due to a situation they don't, but they do go on social media. And yes, I think that's a way for some folks to connect with others and share their stories. Especially, serious mental illness where you might...
Would that be a HIPAA violation if there was some sort of mention on suicide?
It's not only if by a physician, clinician, or healthcare organization. You can go on social media and share anything you want. You're not an organization.
But let's say I'm Cigna, and I have this mental health group, and I'm doing this social media listening, so to speak, to the group, putting all this information into the person's files. And somewhere in there, suicide is mentioned. Is that a HIPAA violation for that physician to intercede based on that?
Oh boy, suicide's a tough one because of the...
Well, the only reason I'm asking that is there had been lots of things about these young kids go out on social, on Facebook and talk about that. And if someone had seen it before, maybe they could have, So I just wondered.
I would say it like this. If you're a healthcare organization, you cannot go on social media and say anything that exposes the person's health situation to the world.
But you could get their information. True?
Not quite yet.
Oh.
Because if you're on social media, anything but Facebook, you have a handle. So matching a handle with a real person's name is not that simple. If it's your Facebook page and we know you're, not we at Cigna, but we at any health organization, know your name, matching that up with who your customer ID is not that simple yet.
I was just thinking of ways that the clinical community could use what you were talking about this morning, the listing.
I would think that would be within a forum or a community as an identified clinicians participating in the community, where the members of the community allowed you in. And correct. You have to be very, very careful with HIPAA on social media. Very, very careful. So I think you can collect the information, learn a lot, but then what you do with it has to be very, very clear and follow the rules. So as you can see here, this is just a diagram how the interactions occur on social media. We've got the public, which is all of us. Now look at all the, it's an eye chart, but look at physician to physician, physician to patient, patient to patient, physician to patient. These are all the ways that humans can connect to share information, which did not exist before social media. So really the huge advantage of web, we call it Web 2.0, which is social media, is the ability to connect with each other and share information quite quickly, quite easily. So the next thing is, does all this lead to better medicine? So I think what we're going to talk about next here is using the data to actually change the actual medicine itself based on evidence. So think about this. Can social media drive evidence-based standards in medical care through greater transparency, expert discussion, quality improvement, and information sharing? I think the answer is yes. So think about that for a minute. We're going to take social media driving evidence-based standards because of transparency, expert discussions, that's the physician-to-physician discussion, quality improvement, such as, let's say, and we'll probably get to it in one of the examples here, let's say I have a bad experience combining Tylenol with aspirin. Obviously, I'm making this up. And I share that. And then a whole bunch of people share the same thing in the course of 6 months. And maybe that combination of medications, obviously I'm using an example that's not true, but that combination of medicines, no one really talked about before, it was known before. But the fact that on social media the conversation was being had in big numbers, causing big issues, is qualitative data that can be documented and fed into other databases to tell us, maybe we should take a look at that. We didn't think of that before. Because once again, people aren't going to their doctor and sharing the detailed stories, but they're detailing it on social media. Whole point being, again, streamline the process, quicker information sharing. Everything we're talking about at these kinds of conferences, health information exchange, whatever, it's all about getting information into people's hands quicker. Whether it's us, so that we're an empowered patient, or clinical spaces so they can make better decisions. That's what social media does. This is what I wanted to begin ending the message with. Social media has transformed communication and is on its way to transforming healthcare. That's not my quote. That's from the American Heart Association. So think about that. The American Heart Association is openly telling the world social media is one of the new avenues to information sharing that will allow us to transform healthcare completely. That's a mind blower. Several years ago, if you thought about any organization as old and as standard bearing as the American Heart Association saying that something like social media is going to transform healthcare, especially when Mark Zuckerberg invented Facebook a few years ago, somebody said that, be like, what are you crazy? It's just for people to play on. Whole different world. So let's look at some side effect stuff, some studies. This is Cedars-Sinai Hospital out in LA. They actually started doing some research that I documented and wanted to share with you. So, Cedars-Sinai has a social listening analytics team like my team. And they went out there and sifted through 2 billion tweets and online posts to find the harmful side effects of narcotics medication taken for chronic pain. Now, just to show you the volume, there's about, I think it's 1 billion posts on social media per day globally. So think about that again as we ground ourselves. 1 billion posts per day, of which a percentage are around healthcare, are being posted every day around the world regarding someone's experience. It's a math game. Think of the information being shared by people every day. So Cedars-Sinai said, let's go study these 2 billion tweets on this particular area. So before I go to the next slide, askpatient.com, patientslikeme.com. So I've actually been to patientslikeme.com when it came to my daughter's autism. These are communities, Jeff, to answer your question before, this is where people go and they share their stories. So if you have a unique, you go to a physician, like Kim was sharing earlier, and the physician shares with you some information. These are one of the sites. You go patientslikeme.com, you start punching in what you just found out about a couple hours ago. You're freaked out, you're anxious, you're nervous, you don't know what's in front of you. You go to patientslikeme.com, and all of a sudden you find thousands of people with your story. Now right then and there, emotionally, that's just a huge oh, okay, so there are other people that have what I've been told this morning, and you start reading. Well, these are one of the sites where we gather the information. Unfiltered sentiments. Important statement there before we go on to the data. Unfiltered sentiment. So, I'm an old poli-sci guy. We used to do surveys and polls. We see them every day now in the news during the political season. Very different than social listening. When I call up somebody when I was 18 years old and say, hi, are you voting for Jimmy Carter or Ronald Reagan? I'm showing you my age now. And I think it was a guy named Anderson who was an independent running against both of them. I'm framing a question in a certain way. The way I say it might tilt the answer. Also, people answer surveys and polls differently because they feel maybe under pressure, or maybe they say, I don't know, when they really do know. Or like when you're at work and your workplace sends out a survey and they say, it's anonymous, and you're at work and you're going, not really thinking it's anonymous. I think I might answer it kind of like they want me to. Social media is unfiltered. The way I like to phrase it is, I'm analyzing what people are saying when they think no one's looking. It's a great way, I think, to say it. When I go on Facebook and say, hey, I had a great time at Epcot today with my family, I'm just saying it. I just feel like it, I'm just saying it. So these are unfiltered conversations that Cedars-Sinai was looking at. So look at here. In online messages, some patients described experiencing severe constipation that was even more debilitating than their underlying illness. Side effect. Cedars-Sinai took that information, started sharing it with the physicians. Boom. Maybe we got to start changing things here. We had no idea that it was this severe. So look at the quote from the gentleman who did all the research. Social media can be used as a huge epidemiological database, a treasure trove of insights from patients about their illness experiences, their treatments, and their attitudes and beliefs about health and disease. Where 3 years ago would you have ever imagined seeing that statement from a place like Cedars-Sinai? And this is what I'm talking about. More and more places like Cedars-Sinai, leading places like the Mayo Clinic, the Cleveland Clinic, they are all incredibly active on social media, both from an engaging place with their patients and with consumers, and in a listening and analytics place. They are gathering more and more as each week goes by unfiltered side effects of medications related to certain diseases, and they're documenting it, putting it in their databases, and seeing if it changes anything they already thought. That's a big, big deal. So, what was their approach? So this is a little bit, I won't go too in the weeds. This is a little bit of how I have to do it. They collected the tweets, ended up being 217,000 posts and 2.5 million tweets. And they put in keywords: pain meds, bloating, nausea, other words associated with narcotics. Then they go to another database called Treato, which collects and indexes patient and caregiver content from 3,000 health-related websites. So as you're starting to see here, it's a whole range of information they're getting. First, they're listening based upon certain keywords. Then they know there are certain websites where people talk. They're pulling that information in. Ended up with 1.8 billion posts. They filtered it down to 3,000 roughly relevant tweets. And we're documented here the most frequently cited issue. And there they are: nausea, vomiting, constipation. Look what Mr. Arnold said here. We were able to filter key signals from the noise in these massive data sets, allowing us to more efficiently distill important patient perspectives that can inform clinical care. Look at the bottom. The online data revealed, I usually don't read slides, but I want to on these, that many people who use narcotics for pain relief often are not warned by their doctor of this especially potential side effect. Some patients then turn to over-the-counter remedies or other solutions of questionable value without first consulting physicians. That is a great use case example. What they found out was the doctors weren't warning about this potential side effect. Patients experiencing the side effect would go take over-the-counter drugs, which might have been counterintuitive to the drugs they were already taking, but they figured, hey, I'm bloated, I don't feel good. What does my doctor need to know if I'm taking Pepto-Bismol or Maalox? What's the big deal, right? Well, it could be a really big deal. Social media data helped inform Cedars-Sinai, which informed the physicians. So now physicians out there were now informing their patients, oh, by the way, you may experience bloating and yada, 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 yada. Here's what you can do, here's what you can't do. Wow. Real world example of changing someone's experience. I just think that stuff is huge. So what they're saying here, this is out at UCLA, this is the blueprint. Kim was talking about this earlier. We can hopefully improve the communication and shared decision making between doctor and patient. All because of insights on social media. So, if we just get that out of my visit here today, it's just to share with you guys the power of social media. It's not just for fun and goofing around on Candy Crush or whatever else is the game of the month out there. There's real data and insights that powerful organizations like Cedars-Sinai, Mayo Clinic, Cleveland Clinic are now starting to tap into to educate their physicians and clinicians, which in turn will enable a more shared and informed relationship with their patients. And, go ahead, Jeff. No, go ahead.
Too much, but I think it's really important to remember too that it's not that physicians don't know that nausea, vomiting, and constipation are side effects of morphine. We know that the very day we first look at the drug. What we assume is that when we write a prescription and we're pressed for time, is that when they take that prescription to the pharmacy, the pharmacist is going to tell them all about those side effects. Or we assume that they're going to read about these side effects because they're going to be an informed person.
That's cool.
What we don't know is this data tells us it didn't get done. Now something has to get done.
Yeah.
It's not that we don't know it.
Yeah.
It's that we don't realize that patients not getting the message.
That's great. That's a good story right there. Boy, that goes to what Kim was saying earlier. You have the patient and the physician, and there's maybe the patient's shy or assumes things. The doctor would tell me it's important. The doctor's assuming the pharmacist is going to say something.
Right.
And what social media is sharing,
It's not happening.
not happening. So it closes the loop.
Yeah. Right.
And that's the kind of stuff that I really hope in the next few years, physicians or hospitals or healthcare organizations start tapping into this database of information. And maybe 9 out of 10 are like, we're good, everything's fine, what we thought was happening out there in the marketplace or patient data is happening. But maybe that one thing every now and then that it's like, oh boy, there's a red flag. We thought that was being solved for or talked about, or we didn't see this one coming. I know that just from a business standpoint, companies see that. When I do research for companies, they'll assume that maybe the biggest complaint a consumer would have would be X. And I'll bring them data and go, it's actually Y. They're like, what? We didn't know that. I'm like, no. Social data is telling us they're complaining in huge numbers about Y and could care less about X. So every now and then there's an aha moment or a nugget where you go, oh boy, we got to change things. Okay.
I think what social media does, to another point I made earlier, was patients and the healthcare community don't intersect outside of the clinical setting. They don't. So in social media, it still happens. You have peer-to-peer patient groups, you have peer-to-peer physician groups, yet where do the two come together and intersect? So it's going to happen because providers do need to know what patients are saying, but the peer-to-peer relationship is by far the most trusted. Whether you're a provider or a patient, we trust our peers, right? But what we've done is taken the conversation that we would otherwise have in person about our experience, we've moved it online, we've expanded it now to many more voices, but we still do not have the two populations within the healthcare system talking to each other. And that's where HIPAA's in the way, I understand that, but until that happens, we're going to continue to have these missed opportunities and miscommunication.
Yeah.
And it's going to continue to burden unnecessarily the coordination of care, the collaboration, and the quality of outcome delivery. So I think it's an educational piece for patients too. They have to know to start really. On our end, we have a huge role to play in transforming care by engaging with our providers in that way. And providers obviously are very consistently got to engage with patients differently. We on the other side have to step up and go, you know what, we have to give our doctors this information.
Yeah, I'm wondering if we're going to start seeing social communities where our physicians are participating with their patients.
I don't see how we can't.
Right?
But it's the trust issue. There's going to be a trust
Right.
barrier there.
Right.
I think, for a lot of people.
Also, and tell me if I'm wrong, I don't know for certain, I should know this because I studied it in grad school, but I don't think that HIPAA rules exist in a lot of other countries. I want to check into that, but I think in other countries, people more freely share their physical conditions, and they don't have that barrier. So social media can be more effective there. Sometimes we get in our own way.
Do they have the same liability too?
That's my point, right? Yeah.
That's,
Right. But I do think, right now, you don't have the physician inside the social media community with the patients openly saying, hey, Kim, great thought on that yesterday. Here's what I think of,
yeah.
which would happen in any other social media community.
Yeah.
But because of HIPAA, the physician might go, I can't say it.
Exactly. And then there's the other side where I know someone who has a fabulous on-site or online community that they started. And now the health system wants to try to peer in, and they're like, oh, no. They won't let them. So there's that aspect of it too, where patient communities are like, we don't want you. So there's a lot of shifts there.
Yeah.
To compound that, there's also the challenge of getting the physicians talking to each other.
And that's what I really would love to see.
Yeah.
Yeah, I agree.
You know, the patient is the common denominator
Yeah.
because she sees this person, this doctor, and this doctor, but a lot of times the docs don't talk to each other.
Well, that's why I'm hoping the crowdsourcing idea will start to take off with physicians, where they join their peer community. They can even go under a handle. I don't think people care.
Not nice.
Identify yourself as, Dr. Joe of Maine. Your name is Bob. Your real name.
Do you think the risk-sharing models are going to move physicians in that direction? Because if you're risk-sharing within your accountable care organization or your hospital or health system, you're going to risk-share with your team members. Your team members. You're going to find information outside of that team to help improve the quality of the work that you can all do.
Potentially, as we heard this morning, the shared risk may start encouraging that.
I think so.
So if you combine shared risk and ACOs with new physicians coming through who grew up on social media,
Absolutely.
you may start seeing a trend more where they're comfortable, they're encouraged, the system encourages them, and they're already comfortable in that world of more of peer-to-peer to lower it.
And healthcare is local, right?
Yep.
It's community-based. However, think globally, act globally. So you need to be globally looking outside of your communities into other healthcare systems and what they're doing. And so online social communication with other physicians and nurses and practitioners is a fabulous way to do that.
Well, think about if you're a physician in the middle of nowhere, USA, but you were in a social community, a crowdsourcing community with physicians from NYU and Mayo Clinic. And you became best friends on social media with Dr. Bob of the Mayo Clinic. And all of a sudden you have a patient in the middle of nowhere who's got something you can't solve for whatever the reason. But Dr. Bob of the Mayo Clinic, who you're good buddies with on your social media channel, boom, you have available information to solve your patient's issue you never might have had before without going through a lot of trouble.
You kind of get to the Doctors Without Borders and new meaning.
Right, yeah, right. So that's the kind of stuff I'm hoping starts to happen. Yeah.
I guess I'm thinking more about accuracy and quality of information.
Yep.
I'm sure we've been told as well that in college, our parents had to go to the library and get books. It's a shame because it's a shame
didn't find the aisle.
You
know, it's like my old Google.
That's what we're told all the time. It's so much easier now that we have computers in our pockets, pretty much. But the amount of misinformation that we have to sift through is the biggest deal. So accuracy of information. Would you recommend a specific, maybe like one general database that all physicians can go to? Because there would have to be a way to be credible on that site.
I think for the physician peer-to-peer community that we were talking about crowdsourcing, I think the key to that was one of the things that was on the slide, credentials. So when you join the community, if you're physician Joe, join the community, you've got to basically share with the community, here's all my credentials. And it's just like a LinkedIn group. And the LinkedIn group says, she can commit, he can commit, they've got the credentials, I want to hear their stories. So that's how crowdsourcing, in my opinion, would work to make sure that that crowdsourced collective data is credentialed. So that's one potential area. It's like LinkedIn groups for business. If I join a social media analytics group, they have to look, okay, what's this guy John do? Where does he work? Okay, it looks like he's got the background. He'd be a legitimate value add to join the group. So that's one way. But I do get your point. Social media, there's so much information now. A lot of it's noise. Like if I had an ACL injury, I could go out, or if I had a pain in my elbow, I could probably go online and find it's a symptom for every disease on the planet Earth. You know, it's like, oh, you know, so there's a lot of noise out there. Totally hear you on that. I think the key is if you're a social listener, you need to develop expertise in getting rid of noise. So the way we do that is very similar to the closed groups. Which data from which groups are we bringing in? So before you even start listening, you have to start filtering out community forums or websites or whatever that you know are just loaded with junk. So there's iterations of cleaning out the noise in social listening. So if you looked at that UCLA and Cedars-Sinai thing, they went through billions of tweets. They came up with 3,000 valuable insights. That's the level of cleaning and scrubbing and filtering the data you have to go through to get the real data. So a lot of that's taking place because of your concern. It's legit.
The other thing would be, you said that some physicians could join under a handle if they wanted, if they didn't want to.
As long as they were credentialed.
Yeah, that would be the thing. They would have to present credentials without identifying themselves as something that's other than the handbook. There is an app right now that I use currently as a nursing student to flip through, and it shows cases, and you can get there's input from credentialed physicians and stuff like that, but you have to send your stuff to like a third party to get verified as a credentialed physician, or like I have to do it as I'm not a licensed RN right now, but as a student you don't have to send credentials off. So that would probably be the best way to go about that, to remain anonymous, but you would still be able to be a credentialed input on the site, I guess.
Yeah, I think what's important to know is two things. We're in probably very infancy of maturity of social media. So the conversation I'm having with you today, 5 years from now, will seem like kindergarten. This is all going to mature. I think what's going on now is people are realizing the power. Whereas 3 years ago it was just fun. Now it's like, ooh, this is powerful. Now you've got companies stepping up, developing software, going into it, into the space. Now concerns like you're sharing are coming up, so then there'll be a way to handle that. So I think there'll be, iterations of maturity that will address all these. Actually, that's why we want people like you to jump in. Because you're the generation, you're the group that's going to clean all this up. You're going to mature this, because you're going to say, when I first started this, I went out there, there was a bunch of crap data out there. And you're going to force the marketplace to give good data. Because you want to play in the space, you don't want to ignore it, but you want it to be high quality data. So it's folks like yourself that are going to push this industry to stepping up. So all the answers aren't there now, for sure, but they will be because of people like you guys.
I find it fascinating that, when you work with data, and it's like you slice maybe we shouldn't put our health information out there because maybe a small business employer might go, gosh, if I put them on my health roll, what happens? So all of a sudden, we've got this constantly changing social media that really sociologists and psychologists have to start analyzing in very intricate ways to try to figure out what does this actually mean. I mean, it's just a constantly, what you said to him, it's constantly changing.
It's not like, it's not a straight line.
Yeah,
It's changing and moving in 4 dimensions
yeah.
every day. That's a really, really good point, because as consumers and people change their behaviors on social media, now the data collection and filtering has to change.
Right. And so you just informed a whole room of people out there
Yeah.
about all this information going on, and now they're second guessing everything that they put on
Oh,
Facebook. And so now we're
I-
evaluating, okay, how do we use it this way, that way? Where do we go to find this clinical information without being too public? I mean, my wife has a chronic disease, and she go same thing you're doing. You have talked about just trying to find answers. And it was interesting to say that people with chronic disease are more likely to do that. And I agree. We're trying to find a way to live life. But how is that going to change everything going forward?
I think what you'll see is just my guess. There'll be communities
Yeah.
where
Crowdsourcing is, yeah, definitely.
there'll be communities where people feel safe
Yeah.
to share their stories, and then maybe that community will ultimately tell its members, we're going to share your story with Mayo Clinic, Cleveland Clinic, but it won't be shared with the public.
Yeah.
Things like that may start to occur where people feel safe.
I have one other question.
Sure.
The other thing is the evolving social network stuff. You know, I'm an old guy with my kids. They're 13. They're like, you're on Facebook. No one's on Facebook anymore. You know, they were on Instagram 3 years ago, and I get on Instagram, and